Are you accidentally making your patient look older, puffier, or even mouse-like when treating nasolabial folds? It's not your fault, and in this video we're going to cover why. Overtreatment in this area is actually one of the most common mistakes that aesthetic practitioners make. I'm going to show you how to avoid the most common nasolabial filler mistake and elevate your practice and your thinking to the next level so that you can create beautiful, harmonious, natural results instead of overfill patients that don't come back. In this video, I'm going to break down 3 critical points: why nasolabial fold treatments often end up looking unnatural and what this means for your patients, how you can avoid making your patients look overfilled by using the missing piece in my framework, the core concepts that will help you achieve natural, full face, high volume results that you can learn just by understanding how it goes wrong in the nasolabial fold. If you want to transform your practice and consistently deliver beautiful, balanced results, keep watching. At the end, I'll reveal how you can learn my missing piece framework. This approach will help you bridge the gap between knowing how to inject and understanding why we need to inject or not inject in all areas of the face. Why do nasolabial fold treatments often look unnatural, and what does it mean for your patients? One of the most common mistakes practitioners make is overfilling the nasolabial fold. And I'm no different to you. I also did this at the beginning because I was too focused on erasing the line itself rather than looking at the face as a whole. The problem if you treat the nasolabial fold in isolation is that it starts to distort the face. It can look puffy, distorted, sometimes even change the dynamics of a smile. And before you know it, your patient, instead of just looking fresher and more natural, starts to look a bit strange. They may not even notice it themselves, but there's something uncanny when you are too isolated, focused too much on single areas of the face that starts to develop. Let's have a look at what happens to a patient when you overtreat the nasolabial fold. As you can see in this image, as we increasingly remove any sign of a fold, it starts to look increasingly unnatural. This is one of the key elements of your training that is never taught, that we actually need all these details. We need to see the difference between cheek and lip, demarcated by a subtle fold. It's only when that fold becomes distracting that we treat it, but removing it entirely is also not the goal. The problem with aiming to eradicate a nasolabial fold is that there are multiple subtle knock-on effects that get increasingly strange as you keep trying. One of the weird ones is it will change how the lip moves. When you smile, you're no longer able to elevate your top lip. So the top of the teeth start to become invisible behind a lip that no longer moves out the way. You also start to overproject the mid-face. It starts to look a bit mousy. You get this mid-face that dominates, is bigger than the chin, makes the nose look slightly smaller, and can make the nose look like it's stuck onto the surface of the face rather than integrated into it. These dynamic and aesthetic changes are very easily picked up as strange. Even if people don't know what is wrong, they know there's something not right. And it's this overtreatment of the area that changes both the dynamics of the mouth but also the surface of the face and removes important detail that our brains use to define different elements of the face. We need to know the difference between the lip and the cheek, and a subtle change in the surface of the skin is part of that. If you delete it, it doesn't look natural. The solution is to think differently about the face. We need to assess the face as a whole, but we also need to know where we need indentations and projections. They are all part of the face. The shape of the human face is not well taught in aesthetics, and until you understand these components, it's hard to understand when you've added too much and when you've added just right and when it needs treating in the first place. We rely on our patients to do it, but this so often leads to isolated focal treatments rather than holistic, full-face solutions. I recommend a big shift in your mindset in one particular thing. No patient wants filler in their nasolabial fold. What they want is to look fresh, beautiful, natural, much higher level goals than just treating the fold. When they ask you for filler in their nasolabial fold, it's because they think that's what they're going to get, to look fresher, more beautiful. They think it's going to make them look younger or more attractive. That's their real goal. They actually want an expert to give them younger and more attractive, not just filler in the fold. It's this shift that will allow you to talk differently to your patients, but you first need to know the shape and detail of the face so that you can make sure you make the right aesthetic judgment along the way. The missing component of aesthetic education when it comes to nasolabial folds is knowing that it is actually a low point, a definitive point of the face, just like the apex of a cheek is the definitive point of the cheek. Without knowing what should be there and what shouldn't be there, it becomes very hard to know when to stop. What is needed is a full three-dimensional aesthetic framework for every part of the face. I developed this framework and it will allow you to view the face more holistically rather than just targeting one problem area. It'll also teach you when to start and when to stop, not simply the lines that we want to erase. The goal, after all, isn't to simply erase any shadow or fold. It's to help you create a beautiful, natural result. Think about it. If you could understand the three-dimensional relationships between facial structures broken down into a framework that would allow you to decide when a structure is undertreated, overtreated, or just right, wouldn't that make it a lot easier to create full-face treatment plans that actually make patients better looking? Let me talk you through my decision-making process with this patient when I approached her nasolabial fold. The first thing is to be aware of the basic shape of a cheek. Every cheek in a female has 3 distinct defining points. These are the most projected elements of a cheek. We have the angle of the zygoma, the zygonian, which is the most lateral projected point of the cheek, and then there ideally should be an anterior projection here, just on the same line. There's also the low point of the midface, seldom taught as such, which is actually the base of the nasolabial fold. This is a natural inverted point that helps define the shape of a cheek and differentiate the cheek and the lip. We also have 2 other low points to be aware of in the midface, the lateral canthus and this inverted point underneath the cheek. The overall shape of the cheek is then decided by a defining line that connects these points together. So this is the first line that I know I need to create or preserve, that defines the outer bulge of the cheek, terminating at the nasolabial fold at its innermost point. Underneath that, we have the inverse defining line of the cheek. This is what gives the cheek its differentiating shape to the jawline. We can see the difference between cheek and jawline. You can also start to see how there is some emptiness below this, but also above where the cheek meets the lid. This is a bigger part of the treatment that we covered. But let's have a look now at the nasolabial fold in particular. Because some of this fold happens due to a lost volume above, we will replace volume along this line in a way that also takes into account the overall shape of the cheek, connecting the planes underneath it to the inverse line. Once this is done, the nasolabial fold is easy to treat. The area I want to focus on is the lower aspect. So this area from here to here is the most important aesthetically to soften, bearing in mind I don't want to lose the disconnection between cheek and lip, I just want to soften it. The base of the nose needs to be defended. This is a natural low point, and although I may add a little bit of volume, I'm not trying to completely delete or overproject this point. So a subtle treatment here is also included. This is a periosteal level injection. My approach when treating nasolabial fold, which has a combination of a crease alongside volume loss, is to use a sandwich-like technique. You can inject the base of the fold with piriform fossa injections. The mid layer is treated with a cannula to support the tissue, but not treat the crease. And then the most superficial aspect, you can treat gently with a soft filler so that you just take away those deeper elements of the crease. The end result should preserve the natural boundary between the lip and the cheek if the patient has this shape. When you learn to see the face in 3 dimensions, you'll start to identify the gap between a patient's current appearance and their full aesthetic potential. This is the central skill of an aesthetic practitioner. This mindset not only transforms your results, but also builds long-term trust with your patients. We need a framework that teaches us not just about the proportion or the techniques used, but about the actual shape and detail of different elements of the face and how it all works as a whole. The individual components, the most projected points, how those points are connected together, and the planes that make up the surface of a human head. When the injector understands the desired 3-dimensional shape of each part of the face, you can start to assess in much more detail. Do we need to add more volume or less volume? Do you want to make a particular point project more outwards, or do you want to blend it in so that it's less dominant in the face? The missing piece in medical aesthetics training is the ability to diagnose the aesthetic potential. This is the gap between where a patient is and where they could be, because if you can diagnose that gap, not only is it useful the first time you see your patient, but it's useful in managing them over a lifetime. It gets harder the longer you see patients. You cannot rely just on the common patterns of aging. You need a framework to assess each point systematically to keep everything in balance. Over the last 4 years, I've looked in depth at the structure and shape of the human form in 3 dimensions from an artistic-only perspective. And I'm applying this to medical aesthetics. If you would like to learn my framework, click the link in my description for more information.